Can you share with us a little bit about that and really some of the transformation you've been seeing with your patients because of it?
Yeah, sure. So, like I mentioned, we do have kind of our traditional IV ketamine protocol where we really, and the Spravato is twice a week for 4 weeks. That's what the FDA has recommended. So that's what we do. And then once weekly for those patients. So outside of kind of that comprehensive, Spravato or IV, we also have partnered with Dr. Bregman, Benjamin Bregman. He is a psychiatrist in the area in Washington. He is phenomenal and has his own psychiatric practice. We kind of started talking through, and actually, it was his idea. He kind of brought to my attention that he sees a small subset of patients that don't have a diagnosis, and he's a psychiatrist. So if anyone's going to diagnose them, it would be him. And he's phenomenal at what he does. But what he and his psych mental health nurse practitioner, Heather, have brought to my attention is that they see a subset of patients that don't have a diagnosis, but they feel very stuck. And they feel like, what used to bring them a lot of joy, they're not necessarily depressed or anxious or any of that. They don't have an official diagnosis, but they're at a point in their lives where, the things that used to bring them joy don't necessarily bring that same level of joy, or they've lost a little bit of the zest and they're feeling stuck on one or two areas. Maybe they're looking at retirement and that's really scary, or they're moving, or they're in the midst of starting to talk to their long-term spouse about a divorce. So there isn't an official diagnosis, but they're feeling stuck. And so this program that Dr. Bregman and Avesta are partnering on is that he meets with the patients pretty intently, him and his team, and they start to talk about, what some of the issues are, what is at the crux of it. Then they start talking about ketamine as a way of building neuroplasticity and kind of starting to think about, causing a little bit of a paradigm shift. And then the patient comes in with Dr. Bregman or one of his staff, usually him or Heather, his psych mental health nurse practitioner. Either one will come in, they'll sit with the patient in our clinic as we do a 1 hour infusion. And the dosing and everything is determined by the nurse practitioner based on the patient's weight and kind of in real time.